Hi guys, welcome back to my channel. So first, I would like to apologize if I wasn't able to upload video, especially yung part 2 ng ating cervical cancer awareness. Medyo naging busy lang ang atin yun lately, and because we are organizing an event every Saturday yun for the whole August. So, doon ako nagfo-focus right now because it's an event for a cause. Kaya very timely siya right now, and talagang ang sarap niya gawin because in times like this, kahit sa ganung paraan, nakakatulong ako sa kapwa ko. But don't worry guys, when it comes to our part 2, actually this is a part 2 of our cervical cancer awareness, but I'll just give you some information lang. No? So I made a content, I did my research, and para to sa part 2 nga na ating cervical cancer awareness. So actually I'm almost done na with the shoot. Kaso I just realized kasi na it will be better if ang i-share ko sa inyo is a lecture na talagang may matututunan kayo, at a lecture din na something na galing sa isang specialist. Yun nga, so we had a free webinar that happened last Saturday, August 8, 2020, and it's all about cervical cancer. Actually, nag-live din ako noon dito sa ating channel. Meron mga 13 or 14 din na nag-watch. So, thank you for those who have watched and supported that event. And yun nga, it is a full topic about cervical cancer. Doon ko na-discuss, or doon nila na-discuss what is cervical cancer, ano yung cause, ano yung symptoms, treatment, prevention, how much is the treatment to cost, ano yung available screening that you can do or use, especially in times like this, kasi alam naman natin na it's pandemic, and mukhang matatagalan pa to according to the expert. And doon din kasi sinabi ko anong klaseng treatment ang pwede mong gawin right now. So that webinar kasi, it's an awareness talaga guys. So imagine mo, napapaisip ka if sinasabi ng mga specialists na curable ang cervical cancer, bakit ang dami pa rin taong namamatay due to this disease? So doon din sasagutin ng doctor na nag-conduct nga nung talk, bakit may mga namamatay pa rin in spite of the fact na curable siya and preventable siya. So, kaya I've decided not to continue yung video na ginawa ko, although naghirap na ako doon, and it took me the whole day just to do that shoot. But it's okay, kasi feeling ko mas mag-benefit kayo kung isi-share ko sa inyo yung nangyari last Saturday. I will share sa inyo yung video mismo, the whole lecture, yung pinaka-lecture lang guys ha, kasi masyado na mahaba kung isasama ko yung buong event. But I'll just put the link down below, the whole event na nangyari nung last Saturday. So, just para at least kung interested kayo or curious kayo ano ba talaga nangyari nun, nandun lang siya sa link below. So, yun nga, medyo mahaba siya. So, medyo yung pinaka-link lang talaga ng lecture ang i-share ko sa inyo. So, please watch until the end. Para at least, yun nga, it's very informative kasi kaya kailangan mo talaga siyang panoodin. So, before I show you the video ng lecture last Saturday, I will give you again some information muna nga about that. Yun nangyari. So, last Saturday events, it's about telecervical screening in the new normal. So, napapanood itong topic na to, obviously because of what is going on in our country and even the whole world right now. So, yun nga, due to pandemic, the cervical cancer screening has decreased by 96%, and this information is according to, actually ganito information ito sa Director ng Philippine Cancer Society na si Sir Rom Marcaida. So imagine guys, 96% because of the COVID pandemic, halos wala na nakakapag-cervical cancer, cervical screening. So nakakalungkot at nakakatakot to guys, especially sa ating mga kababaihan. So alam din naman natin guys that cervical cancer screening has been a tedious process in some areas, especially in the far-flung areas that could take us as long as 3 weeks to receive the result. So, imagine mo yung 3 weeks na nag-aantay ka ng result, tapos may nararamdaman ka sa katawan mo, hindi ba parang sobrang distressing yun? Kasi nga parang iisipin mo, ang tagal ng result, ano kayang sakit ko, parang yun eh, yun yung isa sa mga reason kung bakit kailangan, kung bakit yung speaker din dito is nakapag-isip kung ano ba yung dapat gawin para mapabilis yung result and then matulungan yung mga kababaihan to prevent cervical cancer. So, what if there is a way, diba? What if there is a way that we can continue, sorry, screening despite the times right now, despite yung nangyayari sa atin ngayon. So, dito po pasok yung event na sinasabi sa inyo kanina pa nga. So, meron din silang in-introduce dito ng mobile application that could help patients, midwife, nurse, or even the doctor to do the screening. So, in this cervical screening, you don't need to go to the clinic or hospital, which is, kasi di ba kung lalabas tayo right now, sobrang nakakatakot talaga guys. Kasi you'll never know kung anong sakit or virus ang masasabukan natin sa labas. So it's better to be safe than sorry. So right now, if you go out, yun yan, so nakakatakot. But this new technology can let you be safe and have screening right at the comfort of your home or even in a satellite area siguro that can have screening na very convenient sa lahat and safe as well. Yun yung pinaka-importante. Dapat safe tayo lahat. So yun nga, in-introduce din nila dito yung mobile application tinatawag natin na CerviQ. So CerviQ, again, is a mobile application that aids in detecting cervical cancer using a smartphone, making cancer screening possible and accessible anytime, anywhere. And yung result nito, guys, is very accurate at mabilis siya. Unlike before that it will take you 2 to 3 weeks just to get the result and you need to go back to the clinic or hospital just to get the result. With CerviQ, within the day or less, makukuha mo yung result mo and you will, yun nga, so ganun siya kabilis at ganun siya ka-accurate. So you will learn a lot of it later sa lecture kasi doon i-discuss lahat ano yung benefit, ano yung features ng mobile application na ito. So, yun nga, again, no worry guys, malapit na tayo. I will show you the lecture na. But before that, before we start, of course, let me just introduce to you our guest speaker. His name is Dr. Bogs Rivera. He is a cancer specialist and a proponent of CerviQ. And he discussed about cervical cancer and the technological innovation that we can avail to make the screening available as we usher into the new normal. So by the way, guys, the lecture is quite long. Yun nga, i-remind ko lang kayo again. The lecture is quite long, but definitely marami kayong matututunan, especially for those who have a lot of questions in their mind about cervical cancer. So hope this lecture will help you at masagot yung mga tanong nyo. So guys, hindi ko na patatagalin. I will be back later. At the end of the lecture, I will be back later. So without further ado, please welcome Dr. Bogs Rivera.
Okay, so definitely this presentation is quite long. It is divided into three parts. One is the information, so mainly what cervix is all about, what the causes is all about of cervix, of cervical cancer, the symptoms, the treatment, the prevention, no, and then the second part will be divided into people. How can you help as regular individuals, or probably if you're part of an organization like Rotary, like Inner Wheel Club, or any or non-civic organization at that. And then lastly, I'd like to give and I'd like to hear from the audience, what do they think? How can they help? How would they want themselves to be aware of cervical cancer? So that's it. Next slide. Okay, this slide comes from the Department of Health, practically, and we can see it. Please, next slide. Okay, so basically what it says here is that cervical cancer is the second most common cancer site in Filipino women. No, the new cases in every year. This is annual. Ibig sabihin, taon-taon, no? Kadalasan falls around 7,277 cases, no? The deaths are about 3,807, no? More or less annually, no? So, next slide. Okay, so when you try to compute that, though, when you try to compute 3,807, you divide that by 365 and 0.25 because 365 and 1/4 days in a year, no? So you practically somewhat get about 11 Filipino women dying each day from cervical cancer. Kakatakot ba? Well, please wait when I say next slide, please. Okay, please wait. Okay. Now, that's about 2 hours and 10 minutes each day. Sorry, that's about every 2 hours and 10 minutes may namamatay due to cervical cancer. Next slide. Now, this is quite alarming, no? I think this is not my slide. This should be. Are you sure this is my back? Could you back a bit? One picture a bit. Yeah, kasi video pala yun. Anyway, next slide. Sige, next slide. Okay. This slide supposed to be show a picture of the Congress banquet by the AOFOG. AOFOG is the Asia Oceanic Federation of OBGYN in the whole Asia Pacific, no? So what is this? This is an organization mainly supported by the WHO, supported by the Philippine Obstetrics and Gynecology, supported by the Department of Health, and supported by CCAP, no? All these 5 institutions, they just signed a memorandum way back November of 2019, no? This was during the Philippine OBGYN Society Congress banquet, no? And what is that signing all about? Mainly one thing, that is to eliminate cervical cancer, and that to save women's lives. Next slide. That's the picture. No? So again, I do apologize because we're quite in a rush. So next slide, please. Okay, so let's go mainly to what is cervical cancer. So yeah, what is cervical cancer? Yeah. A teacher asked Pedro and says, Pedro, ma'am, ako, alam ko yan. Oh, cervical cancer, cancer of the cervix. Oh, madali, right? Yeah. But where's the cervix? Next slide. Now, when you put a speculum inside a vagina, like what is shown in the picture, the dulo, the endmost portion, no, or the end portion is the cervix. Actually, the cervix is part of the uterus, no. It's the lowermost portion of the uterus, no. So normally when you go to labor, no, that's the one that says, oh, 2 cm, 4 cm, 6 cm na po, uy, 10 cm na po, malapit na pong lumabas. That's the one that they measure, no. That's the cervix. Next slide. Okay. On anterior, when you're actually holding the speculum, that's the part that you see. No, in this case, medyo malaki yung butas, so most likely this is a multigravid na. So marami na, nakapag-anak na ng marami. Next slide. So what is the cause of practically cervical cancer, no? Okay, what is the cause? Next slide. The cause of cervical cancer is an infection. It's human papillomavirus, no? It's the only, it is causing about 91 to 93 depending upon the literature that you're trying to to read, no. It's somewhat 91 to 93 to 97, or some others say it's 99%, no, is the one that is causing cervical cancer. Now there is a good point in this, no. The reason why we really focused on cervical cancer is mainly because cervical cancer has only majority one cause. So if you eliminate that cause, edi tama ba na prevent mo na ang cervical cancer? Unlike for example other types of cancer where there's genetics, there's environmental, there's smoking, there's a lot of things. You cannot eliminate all that. Cervical cancer is quite different. If you eliminate HPV, then 99% of cases, you eliminate everything. Next slide. So, but practically, what is HPV? No, it's like HIV. No, it's like COVID virus. Again, these are all virus. No, human papilloma virus is a group of more than 150, actually 200 pa nga sabi ng iba, according to some books. No, it is the most common sexually transmitted disease. No, and they are usually majority of cases. Lahat tayo mostly we will have this in our lives, but majority to say these are all harmless, no, and they can actually go away in itself, no. However, some of these cases they lead to warts, kulugo. Okay, kulugo. Some of them they present as genital warts. Warts naman doon sa are, no, doon sa area ng puwet, you know. Okay, I don't want to expound. You get the point. Some of them they cause cancer. Next slide. Now, so mainly this is the low risk type. These are the kulugo na sinasabi ko, no? Itong kulugo na to, no, just for you to, alam ko nakakatakot ng itsura, no, but practically these do not cause cancer, no. These are the low risk. Kaya nga sila low risk kasi ano sila yan, low risk sila. Low risk, kaya low risk kasi hindi sila nag-come to cancer. Now, one of the examples are the HPV-6 and HPV-11. Okay? So, there are about 40 types of HPV that actually goes into the genital part, no? Next slide. Okay, and then out of the 40, no, na pumupunta dun sa genital HPV, no, about 14 lang ang nakakapagpunta sa cervical cancer, no. So linisin ko lang. There are about 150 to 200 HPV types. Of the 150 to 200, about 40 nagko-concentrate sa genital area, no. So, out of the 14 lang ang nagde-develop into cervical cancer. Now, here is the question, no? I have a wart in my hand. Okay? Am I a candidate to develop cervical cancer? Okay, next slide. Well, actually, the answer is, yeah. So this is partly the answer, no. So there are 150 types of HPV, no, and that sabi ko nga sa'yo, out of that 150, majority of these are asymptomatic. When you say asymptomatic, they do not cause anything. You won't even see them. These are skin infections, but you don't see them, no. Some of them produces an effects meaning to say you can see them as, you know, palmar kulugo or palmar wart, no, or in other areas of the body, sa likod and everywhere. Now, 40 of them are genital infections, no, so concentrated yun sa area ng genitalia, and 14 are the ones that can cause cervical cancer. Now, as far as that the question is concerned, kung ang kulugo na yon is on the hand, so most likely it is not the type of HPV that can cause cervical cancer, no? So malamang hindi. Okay, next slide. Now, the types of HPV are classified based on the risk, no? Kung meron tayong low risk, kung mapapansin nyo, nakita nyo kanina, no? These are the type 6 and 11, no? They develop kulugo in the genital areas, but they rarely, some of them they do progress to cancer, no, but some more often than not they rarely progress to cancer. Now, and ito ang problem lang dito is pangit silang tingnan kasi, you know, when you have a genitalia and you have a wart, it's not good looking, but it rarely progresses to cancer. However, on the other hand naman, no, these are the high risk, no. The high risk naman, they do not cause anything. Wala, malinis, clear. When you see everything, clear, no? They don't show any kind of lesion. However, these are the ones that are dangerous because they are the ones that cause abnormal cell changes, no? Or abnormal cell, changes in the vagina, in the cervix, which later on, after persistent infection, proceed to cancer. Next slide. Okay, so these are just some of the types, no? Ang ano kasi, ang HPV kasi, they are not named after Juan, Pedro, not named like us, no? They are named after numbers, no? So these are the very dangerous HPV types that you ought to remember, no, the high risk, no. So I think right now they are about 14. Some books says 15, some books says 12, no, depending upon the edition and depending upon their own interpretation. Now, there are other subtypes, you know, probable high risk that may or may not, and then we have the low risk. Kita nyo ulit 6, 11, and then the rest, no, 40, 42, and everything. So I guess that's it. Thank you. Next slide. Okay. Of the high risk, no? High risk, again, remind ko lang kayo. High risk, these are the ones that progresses to cervical cancer. If you can see the chart, no? Makikita mo type 16 and 18, yung may sungay, no? 16 is most predominant, that's about 55%. And 18 is about 16%, no? So, and then the rest, nakikita nyo, it's on the right side, no? You have 39, 33, 52, 58, you know, and the rest, you know. So I am just highlighting the type, and this is important when you develop a vaccine, no? Kasi when you try to come up with a vaccine, you don't just say, okay, I'll come up with a vaccine type 16 and it will eliminate everything. No, you have to come up with, you know, vaccines for each type. Now, later on, when I go to prevention, that will be discussed, no? Bakit si Cervarix o kaya si Gardasil? Bakit 16, 18 ang tinarget nila? Well, actually, it shows there, no? Because already 71% of cases are caused by type 16 and type 18. Okay, inom lang ang tubig. Okay, next slide. Now, this is just a, you know, some people can say, oh, come on, virus can cause a cancer? Really? Okay. Well, it does, no? So, this is how it goes. So, get infected, you don't know. Okay? Swerte mo if the cancer type or the HPV type doesn't, you know, is not of the high risk, no? However, when you go to the high risk, no, you go down to the lower arrow, no? In high risk infection, it says there, the virus can damage DNA, no? So what does that mean? When it damage DNA, and then this high risk kasi, ang problema nila, they don't just go away. They progress and they persist for long periods of time. Normally, 5, 10, 20 years. That continuous damaging to the DNA will now make the cells divide and grow out of control. And that dividing and going out of control, that's the one that will lead to cancer. Okay? So, ang point din dito is, when you get the infection, today, kunwari, 1980, you get the infection. You develop cervical cancer in year 2000, no? Hindi mo yun nakuha 5 years ago. Nakuha mo yun 10 years ago. So what is my point? My point is, ang haba nung time ng prevention, no? Ang haba nung pwede kang magpa-cervical screening. Sakit hindi ka nagpa-cervical screening? You know, that's the point. Which again, I will try to inculcate later to you. Next slide. Okay, so it does not mean naman na ibig sabihin these are asymptomatic. Eh wala tong evidence, no? If you see the leftmost part, that's the picture of a cervix, normal cervix, no? When you have an infection, some of them, they look at, it appears parang gano'n, no? It's on the second to the left, no? It's HPV infected cervix, no? Pag nag-progress, no? Sometimes parang ganyan, no? Hindi mo naman makikita yan, walang simptomas yan eh. So hindi ka magpapatingin. I guarantee you, hindi ka magpapatingin because walang simptomas yan. For you to do that, you have to do screening, no? Okay, now, imagine 10 years hindi mo napapansin, may ganyan ka. That later on progresses to precancerous. When you say precancerous, it doesn't necessarily mean na cancer yon. May pagkakataon ka pa, no? Parang ako, binigyan niyo ako ng pangalawang pagkakataon to speak to you because we have a technical, issue earlier. Anyway, so thank you, by the way. So precancerous, no? This is not yet cancer. You still have time, no? Okay, later on, but remember, during this time, wala ka pa ring simptomas. You feel fine. No, nothing. I tell you, no, nothing. No. Now, because you don't feel anything, you don't go to cervical cancer screening. You don't do that now. Okay, now, later on, that infection for about 5 or another few more years, that will be the ones to develop cancer. And by the time it grows bigger, then the presentation starts. So what is the presentation? Vaginal bleeding is the abnormal symptom. Normally prolonged, 3, 4, 5, 10 days, dinudugo ka pa rin. Akala regla, but it's not. Next slide. Okay. If you're thinking that if you're going to eliminate cervix, lalaki ka, cervix lang yan eh. So, pakialam ko sa misis ko. Okay, sure, fine, If you're not concerned with your wife, it's okay. We understand that. We get that, okay? But here's the thing that you need to know. Men, women, they're both affected by human papillomavirus, no? In the mouth, in the upper throat, okay? HPV is causing cancer there in 30% of all cases. Okay? Penile cancer, 50%. Okay? Vulva, 25%. Vaginal cancer, 80%. Cervix, here, 99%. No? Anal is about 88%. No? So what does it tell you? No? So if you're going to treat HPV, you're not just trying to take care of women. You're also trying to take care of the men. Next slide. So, how is HPV spread? No, it's practically skin-to-skin contact. No, during a sexual activity. No, when you say sexual activity, it doesn't necessarily mean it's just a sexual intercourse. It can include oral and anal sex. Okay, next slide. Okay. Ways that HPV cannot be spread. No? These are ways that hindi mo makukuha itong human papillomavirus. No? Hugging? No. COVID? Baka pwede pa. No? Holding hands? No. COVID? Pwede. Toilet seat? No. Swimming pool? No. Sorry, I can't read much. It's small kasi. Hot tubs? You can't, yeah, no. Sharing of food and sharing of utensils. No. These are things you cannot spread. You cannot get HPV into your system. No? Next slide. So, what is the treatment of HPV? Okay, I'm not asking you what is the treatment of cervical cancer. Those are two different things. What is the treatment of HPV? There is no treatment to the virus itself. Once the virus is there, even the vaccine will not work because you have already the virus. Point number one that you have to remember. One, majority of all these lesions, they go away. So you don't have a problem. No? But what you can treat is the effects of HPV. No? What are the effects of HPV? Well, yung kulugo, di ba? That's an effect, di ba? It's a lesion. Meron kang kulugo dito, pangit, no? So you can treat that. Premalignant lesion, no? Ito yung mga nakuha mo sa pap smear, no? Or via, no? Kita mo may lesion, you can treat that. You can do a lot of things, no? Cervical cancer. Well, yeah, you can treat. No, depende, no? Depende sa stage. Ano ba yan? Is it what is your intention? Is it curative ba or is it palliative ba, no? Palliative means to improve the quality of life. No? That's what palliative means. Next slide. Now, this is a epidemiological study, based from the I think the University of the Philippines. No, I really can't remember. This was the incidence of presentation of cervical cases at UPPGH, and this was done in 2009. No, look at the cases. Majority are what? Stage 3, no? Majority ng pumupunta sa PGH na nakikita nila are malala. I'm sorry, stage 3. But yes, going along those lines, malala na, no? Look at stage 2, 25%, 1/4 of cases. So ano ang napapansin nyo? No? Bakit kakaunti ang stage 1? Actually, yung stage 1 na yan, there are two types of stage 1. Merong 1A, merong 1B1, merong 1B2. Kaya lang dumami yan is mainly because of more of 1B2. Kasi pag malaki na yung bukol mo, then they present as dinudugo ka, and then pupunta ka sa ospital. No? So basically, my point here is, majority of these cases, they go to the hospital because for several years ago, wala silang naramdaman, bigla silang dinudugo. Which is malala na. Next slide. Okay, see here. This is the staging of cervical cancer. No, there is that 5-year survival kang makikita. No, okay, next slide. Okay, look at this. This is stage 3. Let's focus on stage 3 muna. No, remember 50% of cases are at stage 3. No, stage 3 is defined as kumalat na sa pelvic sidewall, so fixed na yan. Hindi na, pag in-IE mo, hindi na gumagalaw yan. No? RVE mo, hindi na gumagalaw yan. No? Okay. Now, it can go down to the lowermost portion of the vagina or pataas. No? Now, look at these cases. Look at the 5-year survival. Anong chance mo po? Hindi ko tinatakot. No? But this is based on literature. Dr. Fauci pa yan. No? Okay. Look at your chance of survival within 5 years. Ano ang porsyento na buhay ka pa after 5 years? Pag stage 3 ang na-diagnose ka. 35%. Do you like that? Siyempre hindi. Next slide. Stage 2. Okay? Medyo lesser ng konti, no? Confined sa cervix, pero sa paligid ng cervix confined. Now, ano ang chances mo ng buhay ka pa within the next 5 years? You have 65%. Well, maganda-ganda ng kaunti. Next slide. Now, kung yung bukol mo is just confined sa cervix, stage 1 yan. No? But then again, there is stage 1 kasi na maganda, no, yung mga 1A, 1B, 1A1, 1A2, I'm sorry. And then you have the 1B1 and the 1B2. 1B2 medyo, yan, around 85%. No? Now, look at this. This is very important. No? Look at this. Next slide. Okay. Next slide. This is carcinoma in situ. What is carcinoma in situ? Ito yung precancerous lesions. No? Ito yung pagka nag-cervical screening ka, meron kang nakitang something, binayopsy mo, if ever man, yung bukol is nandun lang sa surface ng cervix mo. Look at the 5-year survival. 100%. Look at that. Papascreen ka o hindi? Anyway, I'll talk to that later on. Next slide. Now, I'd like to talk more on the cost, on the cost of, not only the cost, but on the treatment. No? Kung ikaw ay stage 1A or carcinoma in situ, or carcinoma in situ, madali yan, hindi yan. I mean, if you are stage 1, mostly you will spend, yan, 150 to 200,000 for a radical hysterectomy. No? Okay? Radhis, ang tinatawag nila. No? Now, if you are stage 1B2 down to stage 3, you will need, yan, radiation, external at saka internal chemotherapy. Because that's my field. Now, for chemo, dapat kasabay nung radiation. Yun ang ideal. Now, for chemo, you need 6 sessions. Normally yan. 6 sessions. I would say mga 10,000 yan per session. So, hindi kasama pagpunta, pa-hospital, medikasyon, or anything else. 60,000. Look at the cost. If you go to radiation centers, facilities, you need about 25 to 28 sessions of external radiation. Isang part lang ng radiation yan. May internal part pa, no? 70,000 pesos, no? Kasama na lahat, but hindi kasama yung pag-aantay, pagpupunta ng 28 days doon sa radiation facility, may libreng COVID pa kung sakasakali, wag naman po sana, sa sobrang pagtagal ng pag-aantay, Anyway, these are just, just to entice, just to make this presentation more appealing to you, make it more, yun. Next slide. And Next slide. Oh, okay. There. Stop. I'm sorry. So that is brachytherapy, no? That's brachytherapy. Brachytherapy is normally we put the radiation inside of you, no, into the cervix and into the uterus, and those into the areas of the parametria. We target that. No, we place instruments and radiation goes in. So practically, it's about 30,000 each, no. Some they can even go as high as 45,000, no. So that's being done around 4 sessions, no. So estimate mga 120,000. Next slide. Okay, so the point is, okay, I get, no, mayaman ka, you get it, mayaman ka. You can afford all the costs that I've said, no, and then but here's the point, no, two things. One, kahit mayaman ka, but did your survival rate improved? No, tao ka pa rin. Okay, sa mata ng cancer, you're also human, either you're rich or you're poor. Okay? Second, ano ba naman yung pumunta ka, magpa-cervical screen ka? Bakit mo pa kailangan antayin na kahit mayaman ka, but you don't have that 5-year survival rate? There is loss of financial loss. There is family issues, economic issues as well. No, it's good if you have insurance. Maybe if you have like Manulife, probably okay. No, or the others. No, again, I'm just trying to put out Manulife. No, yeah, Manulife. Yeah, you can, probably, but the survival part, no way. Next slide. Now, of course, we talked about treatment already. Now, how can you actually prevent it? Now, there are two ways you can actually prevent it, which you actually can help me with. No, one is vaccine. No, I'm presenting to you now 3 vaccines. No, we have the Cervarix, the Gardasil, and the Gardasil 9. Oh, you can always ask me, docs, saan ba ang mas magandang vaccine dito? Oh, no. I mean, they're all good. Okay, it's just a matter of how they are targeting women, or how they are how presenting their product. Okay, let's start with Cervarix. No? Next slide. I'm sorry. Now, Cervarix is targeting the most common. No? So the most common is type 16 and type 18. So Cervarix is targeting the most common. So these are just recommended for women. No? Because women lang ang merong type 16 at saka type 18 na nagkakos ng cancer, yung mga iba hindi, of different HPV types. No? Okay, next slide. Gardasil is the first in the market. No, they are also targeting type 16 and type 18. Plus, they are also targeting itong mga pangit na to. Sorry, itong genital infections na to. No, that's the that's the type 6 and the type 11. No, so again, they're trying to target that. So if you don't want to have that, then might as well go and get an injection of Gardasil. Next slide. Now, Gardasil 9 is the newest. No, it's about 6 years, 7 years, maybe. I can't remember. No, they are targeting yung Gardasil na kanina, which is type 16 and 18, and then they're also targeting the 6 and 11, ito yung mga genital infection. But they are also targeting the 58, the 52, the 33, the 31, the 49, and the 39. Okay? So, it has an expanded coverage of target. Now, here's my question to you. Sa tingin nyo, kung ako nakapagpa-inject ng Gardasil 9, sa tingin nyo, okay na ako? I mean, it's just a question. Tingin nyo, hindi na ako magkaka-cervical cancer. Meron na akong protection eh. Diba? Meron na akong tinarget ko na. Okay. Next slide. Ay, wala dito. Okay. Can you go ahead in advance muna just so I understand? Kasi I cannot see my presentation eh. So, okay, go back. Okay, go back. Okay, I'll try to answer that question later on. No? Okay, the best time, no, to give an HPV vaccine is between age 11 and 12 years old. No, the current indication is of HPV vaccines are between the age of 9 down to 26. Kung ikaw ay 27, hindi ka na kailangan bigyan ng vaccine according to this. But then again, bakit? Well, maybe the reason why is, ang sabi nila, habang bata ka, mas mataas yung immune response to the vaccine. Remember, the vaccine works, they inject you with an attenuated virus, your immune system will come up with an antibody so that when you have that virus in your later life, when you're exposed to that virus, you have the soldiers actually to defend yourselves. No? So that's it. No? So kung sabi nila, kung may edad ka na lang ng konti, baka hindi ganun kalaki yung immune response. No? Now, there is an exemption to that. Next slide. Although this is very, very relatively new, no? Quite recently, I just can't remember the date. It should be here, there. October 5, 2018, the FDA in the US approves Gardasil 9 to include coverage of individuals between 27 to 45 years old. But, personally, the data is still not, well, personally, again, that's me. The data is still not that mature. So I'd still go for the 26. Next slide. Okay, question. Wala kang pera eh. You cannot afford to get 3 doses. Oh nga pala, I forgot to tell you. No, again, I'm sorry, I forgot. If you are 9 to about 14 years old, you need only 2 doses. No? If, however, you're 15 to 26 years old, you need 3 doses. Question, paano pag waka pera? COVID na trabaho, 'di ba? Wala ka pera. So, do you think single dose will benefit, single dose, one shot of HPV will benefit? In this trial, it actually addressed, sinasabi nila, there is some benefit. Well, according to this study, there were some benefit. Let's go to the conclusion of the study. Next slide. Okay, here's the conclusion. More than half of the decade after HPV vaccination with single dose, single lang, okay, against HPV 16 and 18 infection remained high. And HPV 16 and 18 antibodies remained stable. So, ibig mataas. So, okay naman. No? A single dose of bivalent. Bivalent is Cervarix or Gardasil. No? Hindi pala. Gardasil is quadrivalent kasi 4 eh. Bivalent is Cervarix. Bivalent HPV vaccine may induce sufficient durable protection that obviates the need for more doses. Anong ibig sabihin nito? Although this is just a study, no? Hindi ibig sabihin study pangangalandakan mo na sa buong mundo. Tama ito. No. This is just one study. In the doctor's life, kailangan maraming study, kailangan mo pang i-meta-analysis yung buong study whether your actual question is valid or not. In this case, this is just 1 or 2 study. No? Another thing is that what they found out is that this is interesting. No, they injected HPV 16 and 18, and what they saw was they even had a cross protection. Naprotektahan din sila nagkaroon sila ng antibodies against HPV 31, 33, 45, 35, 58. What is my message to you? To everyone listening, here's my message. Kung wala kayong pera, I understand that. But then again, I am not recommending it. But then again, it's upon you. No? It's not from, what is it? If wala kang pera, ano ba naman yung magpa-inject ka ng 1,300? No? Kesa, wala. It's still going to protect you according to this study. And then this study pala, for you to be able to duplicate the study, if I'm not mistaken, the patients, the subjects here were practically injected about age 18 to 25. So kung age 18, 25, waka pera, dahil may COVID, waka trabaho, get the injection kahit isa lang. Again, I'm not trying to be, and then maybe later on you can boost if ever that is needed. No, these are again, but because I do understand what the Philippine economy is right now, and that's why I'm trying to help you out the best I can. Okay? Next slide. Now, in anything that we do, mapa facial or whatever, there will always be an outcome and a bad come, no, or a side effects. Okay, so any medicine improves you on that portion, they always have a side effects. Okay, vaccine like HPV have side effects as well. They can be categorized into three. One is local, sa injection site. In-inject ka, masakit yun. Namumula yun, namumula yun, masakit pag, pagka hinawakan, but, 5 days time, mawawala. Two, general symptoms, lalagnatin, nagsusuka, diarrhea, nagkakaroon ng joint pain, but these are, and ang nakakatakot lang dyan is yung anaphylactic shock. No, if you have allergy on rubber gloves, plastic balloon, condom, baker's yeast, maybe better tell your doctor before you get these vaccines. And then again, I don't want to hide, no. There are cases also of severe and distressing symptoms with HPV vaccine. No, there were even some scare, no, in Japan, Colombia, European countries about people. They go into shock, they go into syncope, hinihimatay. But mostly, some of them are having paresthesia. You can search that over the internet. But according to the WHO, next slide. According to the WHO and the Global Advisory Committee for Vaccine Safety, these are the bodies that actually monitor the side effects of vaccine. According to them, everything is good. The HPV has a global profile, and that mainly these people having these things are not attributed directly to the vaccine, but maybe directly attributed to the general public, meaning to say it can happen to everyone with or without the vaccine. And that was the findings. And again, I'm just trying to bring this out to all of you. Next slide. Now, recently, Australia was on the news. This was in 2018, no? They are actually one country who are way far ahead from us. They are now on the portion that they are trying to eradicate cervical cancer, while we are just starting it, planning it, trying to think of ways how to. Let's look, how did they do it? Okay, how they do it? As early as year 2007, they already have an HPV vaccine national immunization program. So they gave free vaccines to all teenage girls, age 9, 11 to 12 to 14 years of age. In 2013, they even expanded this injection to cover boys. Because, like I told you earlier, boys have mouth, penile, they're also prone into that. I'm sorry, I'm getting distracted with this phone. Anyway, so that's why, and mainly, that's it. And mainly, boys are middle men, carriers between women in some cases. I'm not saying all. And then in 2017, they actually also organized. They improved their cervical screening. Initially, it was just cytology, which is pap smear, and they improved that into HPV testing, DNA. Parang COVID, DNA reverse transcriptase. So they improved on that. Okay, so next slide. So one part of the prevention is practically cervical vaccination, HPV vaccine. If you try to eliminate HPV na high risk, then most likely you will not end up getting cervical cancer. Another, paano kung 26 years old ka na, hindi ka pwede magpa-vaccine, wala ka lamang pambiling Gardasil 9. Okay? Paano kung, remember, ang Gardasil 9, only protects you from 7 of the 14. You can still get cancer from the 7 other remaining, di ba? Remaining types, no? So pwede ka pa rin magkaroon ng cervical cancer kasi hindi naman in-encompass ng Gardasil 9 lahat ng HPV na nagkukos ng cervical cancer, no? Another thing is the data, no? The data is still missing, no? What do you mean data? Look at it this way. Ang mga vaccine po binigay na ano lang yan, na ilabas lang yan, mga 2006, 2007. So, from day of 2006 to 2007 to today, that's about 12 years, probably they have a data na after 12 years, mataas pa rin yung protection mo. Mataas pa rin yung antibodies mo against HPV. How about 20 years? Do you have that data? Paano kung mag-i-inject ba ako ng 14-year-old ngayon? When this 14-year-old goes to 34 years old, are you sure protected ba siya? I don't know. We don't have that data yet at this point in time. So we are just assuming, well, baka. I don't know. Baka magkakaroon ng booster later on. That will be defined by the data. So kung ang sinasabi ko is, cervical vaccine is not the holy grail in eliminating cervical cancer. No, it's not. It's not. It should be complemented with this one, cervical cancer screening. What is cervical cancer screening? Next slide. Oh, ito pala. So, do I still need cervical screening despite the vaccine? It says here, do I still need cervical screening despite the vaccine? No. You need cervical screening despite the vaccine. Why? Again, because of the coverage, no? Because Gardasil only eliminates 7, no? 6, 11, 16, 18, 31, 33, 45, 52, 58. Where there are right now 14 high-risk HPV causing cervical cancer. So, kulang pa rin. Pwede ka pa rin magkaroon ng cervical cancer doon sa 7 na hindi kino-cover ng Gardasil 9. Next slide. 2 is protection. That's what I meant. No? Yung data, no? Right now, Gardasil has only shown 10, 11, or 12 years. No? Cervarix has shown 9, 10, or 11 years of protection. No? Pero other than that, wala pa. And then lastly, age. If you're more than 26 years old, anong gagawin mo? You don't need to get vaccine anymore. Well, depends sa'yo. If you want to, no, wala namang problema. No, because still can, wala naman masyado, no problem. But I think people more than 27 years old, you should attend to your cervical screening. No, next slide. Let me just pause for a while. Now, shown to you is a screening schedules of the Philippine Cancer Society. Philippine OBGYNS, no, the Philippine OBGYN Society, and the counterpart, which is the American Cancer Society. No, in the Philippines, the recommendation is 2. If you do cytology or VIA, which I will discuss later in a while, you need to do annually. Annually meaning taon-taon. Kailangan nyo pong check up. Liquid-based, no, is another kind of cytology, nilalagay yun sa medium, and then doon baka pwede ka every 2 years. Pero in America, every 3 years. Ang cytology nila. Bakit? Well, mataas kasi yung burden of cervical cancer in the Philippines, unlike in the US. So, doon kakaunti lang, so okay lang. No? Here, mataas yung maraming HPV na, crossing everywhere. So it's better na we have that annually. Next slide. Okay, here it is. No, so we have 3 types of cervical cancer screening. No, we have the cytology. Ito yung cells na sinisilip sa microscope. HPV DNA. This is basically trying to determine kung meron kang kung anong type of HPV meron ka. And then VIA, which is visual inspection with acetic acid. Okay, next slide. Okay, this is actually a video which I don't know how we can show this to you. No, this is supposed to be you have to click that, and there's an animation how cervical cancer is how pap smear is being done, no? So, to your right are the speculum. Ito yung pinapasok doon. Ito yung nagkukuha ng specimen. Kasi sa pap smear kasi, ang ginagawa nila, they get the specimen, no? They put it in a slide, and then i-refer mo yan sa pathologist to read, no? Okay. Next slide. So yan yun, no? So if you put it on a slide, yung uppermost portion ng picture, that is what you call as conventional cytology, no? Sa baba is liquid-based cytology. Ang ginamit is yung liquid. Liquid naman ang ginamit niya, no? So that's it, no? Anong pinagkaiba? The thing is, they said, yung liquid-based daw is more accurate, no? It's more they preserve the cells more. You can identify abnormal cells with that technology than that, no? And then all of this, they go to the laboratory, and then they do microscopy, no, which is a job of the pathologist, no. So yun, so dito dalawa ang doktor, no, and then DNA HPV DNA testing naman is practically the same, no. The same in a sense that same pa rin yung pag-collect. Instead of doing the microscopy, you will need to test yung DNA. Parang yung COVID, no? Swab test, no? You get specimen, put it in there, and then they check what if that's positive for coronavirus or not. No. Again, these two types of cervical screening requires two visits. Isang punta for the examination at isang punta again for the result and the mga payo. Okay, next slide. And this supposed to be an animation, but because we're using now a different platform, we're not using the platform earlier, no. So it's very hard for me to kind of let you see what the video is all about. But this is practically VIA, no. So I'm just going to demonstrate this to you, no. So VIA is practically the same as Pap smear. No. The only difference is in Pap smear you actually scrape the cells. Okay, get the specimen. View it in a microscope. In VIA, it's different. No, VIA is you get 5% acetic acid. No, what is acetic acid? No? In English ko pa talaga, acetic or acetic. No, suka. Okay, no, but not all suka. No, please don't use pinakurat in a cervix. Please. No, kawawa. No, there are specific types of suka that you can only use, no? So basically you get suka, pahid mo dun sa area ng cervix, no, for about a minute. Babad mo muna, no, and then when you remove the cotton or the pledget or the gauze, no, you'll try to observe for changes. Kung yon meron na muti-muti, you call that VIA positive. Kung yun medyo mga parang mamaya I'll show you, no, suspicious for malignancy. Why don't I just do that? Next slide, please. Now, some people say, really? Hindi ba dapat ang pag-discover ng pre-carcinoma is through microscope? Pwede na ba ngayon, lagyan mo lang ng suka, makikita mo na? Well, yeah, that's true. And that's an acceptable fact, no? In fact, I have put it here, no, but it's kind of late now. There's even that PGH study, no, which I would like to quote. Kaapelyido ko kasi Rivera din, no, but no relation, no. She did a study on Pap smear, okay, liquid-based cytology, and VIA. Would you believe VIA found to be more sensitive and more specific ata? But sensitive, that I agree. And they even concluded VIA is practically good. You know, I also would like to ask you this, no, tell you this, no, Philippine Cancer Society, no, I'm which I am, you know, quite a part of, no, sort of, you know. Now, they also did a study, similar study way back I don't know, I can't remember. Way back then, where in fact they resulted comparable, no? Comparable via, comparable HPV. So don't feel na as if pag nag-via ka parang inferior to cytology. It's not. Okay? Don't look at it that way. It's not. Pero ang tanong doon is bakit? Bakit? Lagyan mo na ng suka, makikita mo na kung may pathology or what. Next slide. Now, here's the rationale, no? Normal cervical tissue remains unaffected by the application of acetic acid. Kung meron kang kung normal yung cervix mo at walang gasgas or walang or whatever, walang precancerous yan, walang damage or everything, no? It will not get affected. In contrast, when you have a damaged tissue, no, a damaged cervix, no, when you place suka, mamumuti. It turns to aceto-white. Now look at please try to look at the images, no? Via negative means normal, happy, negative. Via positive, wait, teka, you might need treatment. But if you get treatment at this stage, 100% kang survival. Okay? Now, kita mo on the right side is the suspicious for cancer. No? Hindi yan wart, that's already suspicious for cancer. No? So hindi naman ibig sabihin ganyan ang itsura automatically cancer. You still need to do a biopsy. No? Meron, kasi merong similarity din yan. May mga similarity diyan na cervical cyst. No? Mga similarity. No? I'm not saying ganun. No? So you still need to do a biopsy and then you stage the patient. No? And then you treat for cervical cancer. Magaling na kayo because I've mentioned to you already how the treatment of cervical cancer goes. Next slide. Okay, I just like to show you. This is a image taken from our app. No, we have this mobile cervic app which takes pictures. This is what you call pala is digital cervicography. No. Okay, this is digital cervicography. Ang ibig sabihin nito is pagkalagay mo ng suka, pipicturan mo. Oh, I'm sorry, erase. Pagkalagay mo ng speculum, pipicturan mo yung cervix. Not the vagina, cervix. Okay? I know this is a private part ng babae, but look, is it ano ba? Is it enticing ba? I don't think so. Okay? Now, itong picture na to is different, no? I mean, I'm sorry. Yung pagkasunod-sunod ng picture nito is quite different. Synergate, can you please forward one slide? Forward mo ng isa. Yan. That is the... No. Stop. That is the picture upon placement of speculum. That was the picture we took upon placement of the speculum. When you see it, personally, seems like normal, right? Now, Ron, balik mo. Back. Okay. That is, ito yung nilinis na namin. No? Kumuha kami ng ng pledget. We dip it in a NSS, normal saline solution or salt solution. Linis, and that's the picture. Two pictures forward, please. Okay. After the placement of suka, that's what we see. And what is that? That's already suspicious for malignancy. Okay? So, yon. Next slide. Oh, I'm sorry. Okay. So, hi again, everyone. Are you still there? I hope you're okay. If you have questions, please, on Facebook, I think they have sort of a box, where you can actually type your questions, and then the team can actually see it, and we hope and try to answer your questions. So I just like to come up with a short recap, just before we actually proceed with the second portion, which is practically how are we going to help. Okay, so one, we all know that cervical cancer is preventable, and that prevention is a lot better than cure. We all know that an ounce of prevention is better than cure. Yes, we all know that by preventing it, you won't you would still be alive 5 years after, no? Rather than getting stage 3 when your lifespan has shrunk to about 35%. No? And that what else do we know? That prevention is better in a sense that you can get the prevention by having the vaccine. If you don't have the money, you can just get probably one vaccine, and that the vaccine is being given to teen 9 to 26 years old. What else do we know? And that the vaccine is not the holy grail. It must always be complemented with cervical cancer screening. Now, mind you, no, we all know so many things. But in spite of all this, next slide, we're still down with 11 Filipinos, women, dying due to cervical cancer today. Okay? In spite of what we know, in spite of what we can do to prevent it, that is still the number. The more it's going to increase that number because of COVID, because of there is a decrease in making screening diagnosis. There is a decrease in cervical screening during this time of years, this time, okay, of pandemic. Now, what can be the cause? Let's look first. Why don't we look at the problems and then let's find solution to that problem? Shall we? Okay, next slide. Okay, the first problem could be. No, again, I'm no political missionary here, or these are just my points of view. But you can always object. We don't have a national HPV immunization program like Australia. Yeah, maybe. Yeah, that's one problem. But even before you point that to our government, remember, whenever you point out, 4 fingers point back at you. So don't. Point is, what can you do to help? Don't let government help you. What can you do to help? Okay, next slide. Look at the government's perspective. Now, again, I'm no politician. Can actually the government provide us with these vaccines? Remember, okay, let's assume, there is an estimated 30.9 million Filipino men and women aged 10 to 24 years old that are candidates to receive vaccines. Okay? The standard is giving 3 vaccines and assuming, there are 3,000 pesos per vaccine. So, magkano yun? That's about 9,000, right? 9,000 pesos per patient multiplied to the 30.9 million. That's 278 billion. Can government actually afford that? I don't think so. I mean, I don't know. This is my answer. Next slide. But, do we even stop there? Diba? I think, there are so many ways we can do this, no? It starts with you. It starts with your family, no? It starts with your kapitbahay. It starts with you. You telling people how to, what cervical cancer is. You can be an influencer by actually sharing our videos, putting there, or you can even join us, Relay for Life. You can be part of Relay for Life. We can help you. We can educate you. We can let you know what you can do to become a cancer warrior. Who knows, by you becoming an influencer, you can come up with your own community of cancer warriors, Now, for leaders, people like my classmates in Rotary, I mean, the clubs can actually, if you want to do this, you can come up with contests, Because what is the point? The point is, a lot of people are watching when it's video. No one is no longer watching, reading, much. It's more of visual, either pictures or video. Video are better. So you can come up with your own club as a video contest, for an awareness on probably cervical cancer, or any cancer you would want, probably you can help us build this. Awareness is one of the key. No? So before you point out to anybody, let's start doing it ourselves. Next slide. Now, another factor, no, that can be done, maybe, again, I'm not saying 100%, maybe, was two articles, no, which I found way back 2001, but it still is what it is today. Next slide. Failure on cervical screening. Next slide. So in 2001, 2002, no, there was this World Health Organization health survey. No, they surveyed the whole Philippines, no, Filipino women aged 18 to 69 years of age. They looked at these people. How many of them had cervical screening? 8%. Imagine that. Out of the 22 million Filipinos, there were only about 1.7 million that said, I had screening this year, last year. Okay, baliktarin natin. Kayo, can I see a raise of hands? How many of you did cervical screening? Mark, have you had your cervical screening? No, I'm just joking. I'm just joking, Mark. I know. I'm just pulling a joke. Of course, this is for women. No, so try to. I know it's hard today, COVID, but soon after, maybe. Next slide. Now, there are. This is another study, coming from the University of the Philippines Department of Health Cervical Cancer Study Group. I think Director Rom Marcaida was part of this because he tells me he was part of the study. He was one of the study researchers on this that identified the causes of screening failures. So, what are the failures? Bakit ba walang nagpapascreen? No? Okay. One is lack of awareness. Ayan na naman, lack of awareness. No? Okay. Two, ang general consensus ng mga tao daw is ang cervical cancer screening hindi daw curable. Do you agree? It is curable actually. Pero look at it this way. Yung mga hindi nagpa-screen, by the time they went to the hospital, they are already stage 3, stage 4 advanced. Curable pa ba o hindi? Hindi na. Because they did not undergo cervical screening. But kung ma-change nyo yung mentality ng tao, na you tell them, it is curable. Remember, okay? I tell you, I'm going to rephrase that again. No? Remember, if you have nagpa-cervical cancer screening ka, nahuli kita, cancer in situ ka, or early stage, you have what? 100% chance of survival. Imagine that. Diba? 100% chance of survival. Okay? So, what is 5 minutes, 10 minutes of your time? Rather than a lifetime of financial loss, family loss, regret, Kaya yung mga Manulife na yan, at saka yung AXA na yan, at saka yung Pro-Life, they can help you out when you have these types of cases. I'm sorry. Okay. Next slide. Next is lack of follow-up. Okay. The thing is, totoo naman what is, sige nga kayo, tuwing kailan gagawin ang cervical cancer screening? Magaling. So every year. Okay, that's good. Well, kasi kakasabi ko lang kanina. Pero have I said that a year ago, then you might tend to forget. But mainly, of course, we understand, we are so busy, and it's a normal process, that we tend to forget for people who have Alzheimer's. No. It's normal. I'm not saying you have Alzheimer's. I'm just joking. Okay. And then lastly, the lack of screening facilities, which is this is interesting. This is really interesting. Lack of screening facilities and expertise of doctors. Can you just put one slide ahead? Because I don't know what the slide is next. Oh, I'm sorry. Okay. Next slide, please. Sige, na-touch na natin yan, sayang. Next slide, please. Next slide, please. Okay. Okay, that's good. Thank you so much. Now, lastly, lack of screening facilities and expertise. Now, I don't know if you know this. Imagine yung dami, yung dami ng women na up for screening taon-taon, there are about 22 million of them. Okay? 22 million women needs to be screened every year. No? That's age between 21 to 65 years of age. Okay? So they need screening. And we have what? We have only kakapiranggot na OBGYNs who can do that. We're having something like 6,000. If you divide 22 million to 6,000, what will you get? You will get something like one OB needs to perform 10 cervical screenings each day, 365 days in a year. Wala na silang Pasko, wala na silang bagong taon, wala na silang November 1, wala na silang birthday, kasi they have to screen 10 people. So what is that? Can we increase the number of doctors to that? I don't think so. So that's another point that we have to consider also. No? And there's another thing that I would like to, because it touched on facilities. Okay? Another point that I'm trying to drive at is location. If you go to the rural areas, there are so many facilities, but there's no doctors. So how do you think they can do cervical cancer screening there? No? So again, it's different. It's quite difficult. But then again, government naman has done its part. No? They trained midwives. The midwife trained further midwives in replacement of doctors. But then again, the question na nakasulat dyan, expertise doctors. No? I'm sure you would agree to me. No? Na you don't need midwives. You would need, or you would prefer doctors. Diba? To do the screening sa iyo, hindi midwife. Tama? I think you would still agree. But kulang nga eh. But what can we do? Is there a solution to that? No? Is there a solution to this problem? No? And then, look at it this way. Yung midwife, binasa ng midwife. Ito, very, very interesting to. Well, to me, I don't know to you. No? Midwife, binasa niya. Naging VIA positive. So, pag VIA positive, hindi naman gagamitin ng midwife yun eh. Diba? Isa niyang anong gagawin niya? Ipapadala niya sa doktor. Okay? Pag pinadala niya sa doktor, anong gagawin ng doktor? Di ba i-screen niya ulit? Because, well, I'm sorry, but apparently, they will do that. And when they do that, hindi ba cost na naman yun? Diba? Again, so those are just my issues, no? So, bundol-bundol yung issues natin pagdating sa number, this section, lack of screening facilities and expertise of doctors. Now, how can we, as individuals, as civic leaders, help? How can we, as, common tao, help with this problem? Or are we just saying, we give up? Now, I'd like to show you this video. Synergate, if you're actually ready, please play this video. Because this might be the solution.
Cervical cancer is a preventable disease. Yet, in the Philippines, 11 Filipino women die of this disease each day. Prevention can be achieved through immunization and cervical cancer screening. But, with the onset of the COVID pandemic, outpatient services including cervical screening has ceased for months. And return to normalcy is unclear, which may take months to years. What if, in spite of the times, you can still do cervical screening safely and remotely? Introducing CerviQ. CerviQ is a mobile app that allows you to conduct cervical cancer screening using visual inspection with acetic acid combined with digital cervicography. By downloading our app, your clinic secretary can conduct the screening, take photo of the cervix, and send them to you privately for interpretation wherever you are. The app is packed with exhilarating features. It has a secure electronic medical record that enables you to access your patients quickly and effect efficient care. You and your patients shall be notified automatically of next visits or next cancer screening through SMS. The CerviQ app allows you to print results of screening reads, allows electronic prescriptions, if and when deemed necessary, You can refer your cases to subspecialists, doctor fellows in gynecologic oncology, cervical pathology, and colposcopy, and infectious diseases. And if you slow down from medical practice, you can still get paid doing cervical reads. Furthermore, you can dictate the professional fee you like. Join us today and book for a virtual demo, so we can answer all your queries about the app. Go to cervicalcancerph.com.
Okay, so basically, what is CerviQ? You've seen the video, So there are just some things that I would like to to correct, In the video, kasi it highlights that CerviQ is an app. Actually, just between you and me, it's not. It's a solution. It's a solution that can address the growing need for cervical cancer prevention despite these times. Next slide. Next slide. Oh, there is a solution. Sorry. Next slide. If you're a midwife or a nurse, living in a far, far away land, remote community, without doctors, you can actually set up your own clinic using CerviQ. Health centers across the whole country, you can actually utilize your health centers, by performing cervical screening by schedule. You don't need to build infrastructure, you don't need to do the cost, What do you need? CerviQ. Okay? Now, lying-ins, hospital, you can streamline your patients, You can put them in one schedule, all streamlined, and CerviQ will automatically refer them to their respective doctors, What do you need? CerviQ. Safe pa yung mga doktor. Kasi yung mga doktor, nandun lang sa bahay, binabasa nila yung digital cervicography na pinapadala ninyo. They can interpret, and when they interpret, they can send back the results. Yung midwife gets the printed copy. Gets the electronic prescription. Doktor, bahay lang. Still, you can provide cervical cancer screening. Okay? Now, next slide. CerviQ is not a solution. It's a system. It's a system where we actually train midwives and nurses to online. We can do that. I think Mark can actually train them with the guidance of the Philippine Cancer Society. We train doctors on how to use the app, how to do medical prescription. Electronic prescription, I'm sorry. We can teach them how much money have they earned by doing cervical reads. Okay? So it's a system, Next slide. Oh, it's not a system. No, it's not pala a system. It's a network. It's a network. Because the data that we gather, we share it to the Department of Health. The data that we gather, we share it to the Philippine Cancer Society to build and improve our cancer registry in the Philippines. Not only that, CerviQ plans also to hold a Relay for Life this November. The money that will get goes directly to PCS, Philippine Cancer Society, and that Philippine Cancer Society will fund free cervical cancer elsewhere, using CerviQ again. Now, aside from this, next slide, you're right. Aside, hindi ko kasi kita sorry. Aside from this, CerviQ also has its own SMS network. We notify patients sa cellphone nila of their next screening. So you don't have to have Alzheimer's ka, you will get the text. And then lastly, here's the big difference. In VIA, pag ginawa ng midwife yan, sila lang ang nakakita. In VIA, pag yung doktor ang gumawa, siya lang ang nakakita. What if you want to retrieve or do a second opinion of your study? How can you do that? In cervix, it's easy. You can, di ba, you can get it, you can retrieve it, you can put it for a comparative study for a cervical screening later on that year. Remember when you go to x-rays, doctors, patingin nga po ng x-ray nyo dati. Ikukumpira natin sa x-ray nyo ngayon, di ba? With VIA, you cannot do that. You can only do that using VIA, cervix, and VIA. Okay? So, next slide. Overall, what do you think cervix? Well, cervix, I tell you, between you and me, cervix is just a mobile app. Between you and me, I tell you, cervix is just a mobile app. Between you and me, what cervix needs to become big is, next slide. What we need are people like you. It is you who will make cervix a solution, a system, a network. Thank you. Salamat.
So there you have it, guys. I am not sure if you guys are still here. If you have any questions regarding the lecture, please do comment down below. If sa tingin nyo hindi na sagot yung mga tanong nyo, ayun, comment lang kayo below and I will try to ask Dr. Bogs Rivera na sagutin yung mga tanong nyo. And of course, if you have any inquiries about Philippine Cancer Society, isi-share ko din sa kanila yung mga inquiries nyo, yung mga tanong nyo. Kung gusto nyo makiconnect sa kanila, I will try my best to connect kayo dun sa Philippine Cancer Society. But guys, hindi ako magpa-promise because super dami din nilang applicant kasi who are seeking help, especially those who are in need. And then with regards to the questions or answer ni Dr. Bogs sa mga tanong niyo, siguro i-share ko sa inyo, it's either through vlog or sa IG account ko. So, follow niyo lang ako sa IG ko, guys. By the way, guys, yung lecture na napanood nyo, I already asked permission for that, ha? So, hindi ko siya basta lang in-upload dito. I asked permission to Dr. Bogs if I can share yung pinaka-lecture niya lang. So, we have a permission to that. So, don't worry. So, it's a yes kay Dr. Bogs. So, yun lang. Kaya yun lang yung share ko, yung part lang ng lecture niya. And, yun nga. So, this event kasi, last Saturday event, guys, just to give you, for your information lang, that event is in partnership with Philippine Cancer Society, Relay for Life Philippines, CerviQ mobile application, and of course, our team, CerviQ. So, guys, ilalagay ko sa baba lahat ng link and sa description box ng mga partners namin so you can check them out directly. So that's it for our vlog for our part 2 of cervical cancer awareness. Thank you guys for watching. If you're new to my channel, please don't forget to subscribe and like this video kung nagustuhan mo siya and share mo na rin if sa tingin mo meron kang mga tao na dapat sharean nito. If you want to be updated sa mga susunod ko pang video, please click the notification bell para at least maging updated ka sa mga susunod ko pang video. So thank you again guys for watching and I hope to see you on my next vlog. Bye for now!